Hello, I'm Kathleen Farsuelo, and in today's video, we're gonna do a perineal care. So, by the way, perineal care is a feminine hygiene which usually done to women who have given birth to treat the site of episiotomy and specialty. It aims to prevent the odor and infection from vaginal aggression. For the first 3 days, Lupia rubra, brown to bright red. For the next 3 days, Lupia serosa, bright red to pinkish. A week after, Lapia alba, pink to clear secretion. Just like everything else, we're gonna wash our hands, provide patients privacy by closing the door and closing the window. So, verify our patient using two identification, name and date of birth. So, okay. Can you state your name, please? Okay. Date of birth. Okay. That's nice. Okay. Okay, Mrs. Smith. I am Kathleen Farsuelo and I am your student nurse for today. And so, Mrs. Smith, I am here to give you a convenient care. Is it okay with you? Okay. First, I'm gonna assess your perineum to see if there's any redness or swelling. Okay, so I'm gonna pull down your blanket and put up your shirt. We're going to cover the areas that we're not going to assess, and I'm going to pull down your panties. Okay. So, as per assessment, patient's perineum seems to be a little red. There's a little bit of swelling, but there's no presence of foul smell. So the discharge is a bit pinkish to brownish and the amount is scanty. So, by the end of this video, we will be identifying if there are signs and symptoms of infection, and we will ensure that the patient is comfortable. And now, we will assemble all the equipments. So, here's the irrigating solution. So, we will just assume that this is the irrigating solution. And assume that this is the forceps. The cherry balls or the cotton balls. The waterproof pad. The bed pad. And assume that this is the sterile perineal pad. And this is our gloves. So, Mrs. Smith, I'm just gonna expose your area and I want you to flex your knee for me. Okay, thank you. So, I'm gonna turn you to the side. Please turn to the right because I'm going to put the waterproof pattern. Just no need to worry because I will assist you. And then turn to the side again. And next, I'm gonna put on the bed pattern. Please turn to the side. Into the side again. Alright, thank you. So I want you to be in a latotomy position. Please flex your knee. I'm gonna first apply clean gloves. So make sure that before you apply your gloves, you should wash your hands. My patient is now in a dorsal recumbent position with knees flexed and separated. I've exposed the perineal area. I'm gonna first separate the labia and I'm going to pour the irrigating solution. Using a zigzag motion, clean from the clitoris to lower abdomen just above the pubic hairline. Using a clean cotton ball, cleanse on the inner thigh from the labia majora to about halfway between the hip and the knee. Repeat on the other inner thigh. Using a single stroke, cleanse from the clitoris over labia and perineum. Repeat on the other side. And from the clitoris to the anus. Dry the whole area using a clean paper towel in a top-down direction. And then pat dry the buttock using another paper towel. Okay. Put on a clean diaper or sanitary pad. And then we should dispose our used supplies. And then we gonna wash our hands and document the procedure. So after assessing the patient and the procedure, the discharge was pinkish to brownish, and the amount was candy, which is normal for her condition. And so we just document this finding and then put it in the chart. Okay. Mrs., did you feel any pain or uncomfortableness during the procedure? Okay. So, she did not feel any pain or uncomfortableness. She was comfortable while doing the procedure, and there were no signs and symptoms of infection. So, this is the end of my video in perineal care. And again, this is Kathleen Forswello, your student nurse for today.